we will see some of the basic questions for the upcoming staff nurse examinations from the subject of first aid. The first question is, the term first aid was coined in the year of. So, in which year we have the concept came first aid? Options are 1872, 1878, 1875, 1889. The right one is option B. Option B, that is 1878. So in the year we have the came the concept of first aid. So first aid is nothing but it is a emergency treatment, okay, in the for the patient or the person. It is first aid we can done in the out of the hospital. Okay, for example, road traffic accident or choking or any burns in the house. Okay, so whatever the treatment we will give for the patient, okay, to stabilize, to control the bleeding, for all these concepts will come under the first aid. The next question is, immediate care given to the victim is called. So victim is nothing but affected person. So when we are giving immediate care for the victim is called, options are first aid, preventive care, medical care, none of the above. So what is the right answer? Option A, first aid. So first aid is the right answer. First aid is we will give the immediate care for the victim. The next question is, which of the following is a sign of death? So when the person we have, so by saying which of the signs we can observe on the person, that is the person is live or dead. Options are absence of breathing for 20 minutes. Option B, cornea is milky with wrinkles. Okay, so completely dilation of the cornea, and rigor mortis, all of the above. Rigor mortis is nothing but stiffness of the body, all of the above. So which one is the right answer? Option D, all of the above. So in dead person we can have the breathing, no breathing, and dilatation of the pupil and stiffness of the body we can observe. So these are the signs of death. The next question is traction splint. Okay, traction splint is used specifically for what? Options are spine fracture, spine is the vertebral column, okay, and the femur fracture, fracture of the tibia, and a fracture of radius and ulna. So, for which fracture the traction splint is used? So the right one is option B, femur fracture. Okay, femur fracture we can use the traction splint. The right one is option B, femur fracture. The next one is purpose of bandage. So what is the purpose of bandage? Options are to control bleeding, to hold dressing, enhance the wound healing, all of the above. So what is the purpose of bandage? The right one is option D, all of the above. So the bandage application is for the injuries and wounds, to control the bleeding and keep the dressing pads hold. Okay, for example, we apply on the gauze pad on the wound. After that we will we will rotate the uh, bandages. Why? Because to hold the gauze piece on the wound. And next one is to enhance the wound healing. So dressing will helpful for prevent the cross infection, and improve the wound healing. Okay, wound healing. So these are the purpose of bandages. The next question is collar and cuff. So this named sling is used for. So what is the use of collar and cuff sling? Options are forearm, application for the forearm. Option B, application for the hand only. Option C, application for wrist only. Option D, whole of the upper limb. The right one is option C. Option C is the wrist only. So by the name itself you can understand collar and cuff. Okay. So handcuffs for the cops. Okay. Policeman, they will use the handcuffs like this. Chain will be like this, and cuffs are the criminals will hold it by the handcuffs. So cuffs are only applied for the wrist injuries or the wrist fractures. We can use the collar and cuff sling. The next question is, which of the following is not a thermal agent burns? Okay, so these are the four types of burns which are caused by the thermal agent. So which one is not a thermal agent burns? Options are fire flame, steam, acid, nuclear radiation. So the right option is option C, acid. So acid is not a thermal agent burn. So it is a chemical burns. So these are category of the chemical burns. So the right option is option C, acid. The next question is activated charcoal. Okay, activated charcoal should not. Okay, always keep in mind when you are reading a question, if you get the question like this, not means please note down, should not be given in which of the following cases of ingested poisoning. So among these four cases, in which case we should not use activated charcoal? Options are food poisoning, acids and alkalines, insecticides, petroleum products. So the right option is option B, acids and alkaline. So in this case we should not use charcoals, okay, activated charcoal. Why? Because in this, if we use the acids and alkalines will react with the charcoal, okay. So for that reason we should not use charcoal when the person is poisoned with acids and alkalines. The next one is, which of the following is incorrect during upper jaw fracture? So the person has got the upper jaw fracture. So among these four options, which one is incorrect? Option A, clear the airway. Option B, treat any mouth wounds. Option C, apply hot application. Option D, shift to the hospital. So which one is not correct to do the patient with the upper jaw fracture? So the right one is option C, hot application. So why? Because already the person has the upper jaw fracture, so he may have the bleeding. So during bleeding, if you apply hot application, it will increase the bleeding. Okay, for that reason, we should not apply hot application. We have to apply cold application. Okay, so cold application will reduce the bleeding, and we need to clear the airway. Okay, and then if it is there any other wounds in the mouth, we should treat, and immediately we have to shift the patient to the nearby hospital. So the right one is option C.